I've been getting a lot of questions about connective tissue disorders and how it affects SIBO and digestive issues. And a quick test, it's not foolproof. The real gold standard is to get a genetic test. But quick test, if you can take your thumb all the way to here and you're super hyper flexible, and maybe you were the queen in yoga class or the king, and you could do, easily stick your leg behind, your head without years of warming up and years and years of practice. You probably likely have a connective tissue disorder. This can go along with chronic digestive issues because the connective tissue that holds your guts in place is lax and things sort of flop. So then you have issues with motility, and it can set up problems with SIBO, which can cause intense IBS and bloating and a lot of digestive issues. Now, is there a cure for connective tissue disorder? Not really, because you need to manage it. It needs to be managed. This is your genetic imprint and how you make your collagen. Now, it's possible that doing high-dose sulfur could strengthen the connective tissue, but if you have a genetic connective tissue disorder and have Ehlers Danlos Hypermobility syndrome, it's likely you're going to need to manage it. So you're going to need to do things to manage the SIBO and the IBS, the likely SIBO. You'd of course have to check and see if that was what it is. And part of that would involve being on a protocol, and once you're through the protocol, being on a maintenance plan. And also along with that, I like to refer people for visceral manipulation. It's great to kind of keep your guts in place where they should and support proper motility. And I also like visceral manipulation for people who have had a lot of abdominal surgeries and have scar tissue there, because that also impedes motility, which could set you up for bacterial and fungal overgrowth in the small intestine, which can cause a lot of bloating and IBS symptoms such as chronic diarrhea, constipation, alternating. But you got to deal with the microbiome, you got to deal with the structural issues, and these patients are often a little more complex. And often along with that, woohoo, is MCAS, mast cell activation syndrome. So you get a lot of histamine issues. So you might get rashing, you might get hives, you might get allergic reactions from a lot of foods. But once we heal the gut lining, and once we deal with the SIBO and keep that under control, for a lot of these people, the mast cell activation syndrome shows some improvement, though some people might need to step up therapy to a medication like cromolyn and be managed. I have a patient who was diagnosed eventually with systemic mastocytosis, but she's actually doing quite well because we've been managing everything, all the gut things in the background, and she's maintaining. Now, she'll probably always need to touch base with me every few months, and as we work together, it's not a quick fix, but there is hope, and the root of it starts in the gut. It'll help with the mast cell activation syndrome, it'll help with any of the digestive issues, and it'll help with nutrient absorption. So I hope that's helpful.